The Environmental Health Council, in collaboration with the Federal Ministry of Environment, has expressed its readiness to partner the private sector to further improve environmental health. The Registrar of the Council, Sanitarian Dr. Yakubu Mohammed Baba, made this known while addressing newsmen in Abuja during a 3-day business forum. Baba says it will help in creating an enabling environment for the private sector to contribute their quota and create job opportunities for the teeming youth population. He urged stakeholders to be guided by the rules and regulations issued by the council.
Act number 11 of 2002 that established the council, the president, Muhammad Buhari, in his wisdom, on the 6th of September, signed the amended law and led to the creation of the new name. And this new name also came with additional responsibility for the council, because now the council is expected to regulate the 21 components of environmental health, from food safety, abattoir sanitation, sanitation in the hospitality industries, international regulation, etc. There are about 21 components that made up environmental health according to the WHO. We believe with the consolidation of the legislation that established the council today, government alone cannot deliver environmental health. So we need to also create the enabling environment for the private sector to come and contribute to their quota. And we believe there is a lot of opportunities in environmental health. For example, it is the expectation of the council that after the deliberation in these 3 days, at least 10,000 jobs should be created within the sphere of environmental health. Also, we are looking at also the possibility of the players knowing the rules and the regulation guiding the practice of the environmental health in Nigeria. When you look at the gazetted copy of the membership register that issued by the minister today, this is also in line with what is enshrined in the Act, because the Act also in the enabling section mentioned that the council shall publish the list of the members of the profession. And I think the best way for the council to publish the list is to gazette the membership. And this is also to give the public the opportunity to know who is really practitioner in Nigeria, who is not really a practitioner in Nigeria. Because if your name is not on that list, it means you are not environmental health practitioner in Nigeria. The second document issued by the minister is the seal. This seal, environmental health officer is using the public health law as our legislation. And we have a lot of documents that we are signed that are legal. And the validity of those documents, to make them valid legally, is for you to append your signature. But now, instead of your signature, you use your customized seal. So any legal document issued by any practitioner without a seal remain null and void. The order to be actualized, the private sector needs to come and provide public toilets in strategic places. This is what we call also public-private partnership. This is one segment of environmental health. We have 21 segments that we require the participation of public.
Environmental health risks and exposures are responsible for nearly half of the global burden of morbidity. The WHO states that environmental health is concerned with preventing diseases, death, and disability by reducing exposure to adverse environmental conditions and promoting behavioral change. The linkage of disease burden to human endeavors in various sectors, namely infrastructure, energy, transportation, mining, and agriculture, is complex, much as it is dynamic, when not monitored and controlled, and as such, their huge potential to improve health outcomes and save lives may well be lost. The environmental burden of disease influenced by key risk factors including unsafe water, unsafe food, poor hygiene and sanitation, poor housing, air pollution, disease vectors, chemical hazards, injuries, and accidents constitute the worst predisposing factors of mortality and morbidity in Africa. There are therefore ample opportunities for the private sector to cash in this effort to solve these intractable environmental health challenges, ranging from product development, service delivery, education, and communication, research, and advocacy. These opportunities may not, however, be harnessed except with the reasonable determination of the environmental health business community that are assembled here. As a profession, environmental health is evolving in Nigeria, and rightly so, through the strategic policy directions of the federal government. The government has in the last 2 decades facilitated the emergence of the hitherto occupation into a profession and is growing from strength to strength. The Federal Ministry of Environment is making the environmental health subsector to flourish, owing to its potential of reduction of the disease